All right, folks, finally inside. Let's go see these two emergency patients and get out of here. Oh, what a day. All right, so I guess we're kind of finally done with a couple of these emergency patients, and let's head back home in this crazy snow. See how it goes. Holy smokes, this is definitely not a good day for practice. This global warming's killing us, man, here out in the Northeast. I figured might as well, you know, since there's no transportation today, the whole transportation system is kind of stopped because of the snow emergency. I figured I'll have to walk home, so might as well, in tradition of past tutorials in the snow, we'll make a little quick video here for you guys to talk about this emergency patient I saw today, which I thought was very interesting. So the patient I saw today was actually a patient who was referred for emergency root canal therapy on tooth number 20, which is the lower first, rather second premolar. And this tooth was diagnosed to be necrotic. The patient had acute pain. In fact, the pain was so much that when I walked into the operatory, the patient was kind of just holding his head and in a lot of pain. So basically what we did is patients, a general dentist had diagnosed a tooth the second premolar as necrotic. There was obviously a previous root canal that had been done on the molar, which had now, due to patient's neglect, had not been restored and had decayed all the way down to the gum line. So this tooth was not salvageable, obviously, but according to the initial diagnosis by the patient's general dentist, was not the source of the pain, and that the acute pain was coming from the premolar. And the reason for that was because the premolar was testing negative to any cold testing and also was very sensitive to percussion. So obviously in these cases you can't just go straight to the testing. You have to do the interview with the patient, look at the chief complaint, and check out all these other clinical signs and symptoms as well as the history. And upon inquiring about the patient's history here, I found out that this pain started, and then the patient started to feel tingling and numbness in their lip, on their lower left side, and they started to feel numb. So that's a critical piece of information to have in place, the numbness. Of course, from the radiograph that we saw earlier, you could tell that there is a periapical lesion associated with the roots of the molar that had previous root canal therapy but was not restored. And you know, this could potentially be a source of that paresthesia or numbness by placing pressure on the tooth. So paresthesia could also be due to various neoplasms and different kind of other pathology that could be of non-odontogenic sources. But here in this particular case, the real question was why was the premolar was sensitive to percussion and negative to the cold test. And it turns out that the reason why the premolar that doesn't seem to have any major restoration was non-responsive to the cold test was primarily because of this paresthesia. So pressure from an existing apical cyst / granuloma that was due to this unrestored molar tooth was causing paresthesia that was giving a false response to the vitality tests on the premolar tooth. The best way to find this out is to do additional testing of vitality testing with the cold on the first premolar as well as the canine. And in this particular case, let's cross the street here quickly. And in this particular case, from my testing, I found that none of the teeth in that side were responding to the normal pulp vitality test, specifically the EPT and the Cole test. And that's a very significant finding because it quickly tells you that those tests are not valid. So in that situation, what we decided to do was to basically go with a diagnosis that in fact the apical lesion that we were seeing associated with the molar was the source of the pain, and that it had to, and that it was the infection of probably an existing chronic cyst. We used to call these phoenix abscesses, but it's now an acute exacerbation of a chronic abscess or an infected cyst that was causing the main chief complaint. And the lack of symptoms on the premolar and the canine were primarily related to the paresthesia due to the pressure on the infraalveolar nerve. So the diagnosis and the percussion sensitivity, obviously, on the premolar was due to the expansive nature of this cyst, which was beyond the size that you could see on the radiograph. Anyway, so I'm getting close to home, and I figured I would just share this case that I saw today, which was super interesting. And you know, hopefully I'll make it back home without being frozen halfway in the middle. But if I don't, let's save some teeth.